Hello friends, new week, new MCQ, and this is the MCQ that was asked on all my social media platforms this week. It was related to digestive tract. Let's understand the MCQ and why the answer is D, that is dumping syndrome. Well, first thing is sometimes the MCQs are simple, but the options have a certain angle to them. Once you catch that angle, then the answer will be absolutely right. So let's understand the angle of the options. Okay, first the MCQ. A 30-year-old lady complains of pain in abdomen and there was some growth in the ileum. So surgical resection of ileum has been performed. Which of the following may not be a possible fallout of the surgery? So what is not likely to happen after the surgery as a fallout of the surgery in the ensuing months? Right. Let's see the options. Megaloblastic anemia. Well, now that's easy. You know, vitamin B12 is absorbed from the ileum, and if ileum, and particularly what's important to know is because there are receptors for vitamin B12 intrinsic factor complex, and those receptors are in the ileum. So when you remove the ileum, there are no more those receptors, so B12 cannot be absorbed, and therefore deficiency of vitamin B12 will result in megaloblastic anemia. That will be the fallout of this surgery when ileum was removed. Second is fat malabsorption and steatorrhea. Steatorrhea is increased excretion of fat in the stools. Many students, when they answered this MCQ on the social media, they could not fathom what is the angle in this option. Now look, bile salts, they are secreted into the bile and they come to the duodenum, and then from the ileum they are recycled. It's called as enterohepatic cycling of bile. So the bile salts will be recycled from ileum, they will be absorbed, they will go back to the liver and again secreted into the bile. All right. So bile salts absorbed from the ileum normally under normal circumstances. Now bile salts have a function of fat digestion and absorption. They play a critical role in fat digestion and absorption. So considering this, that the ileum has been removed, this enterohepatic cycling of bile would be deficient. Deficiency of bile salts would result in no proper fat digestion and absorption, resulting in steatorrhea. So yes, that is a possible fallout after ileum has been removed. Third option was magnesium deficiency. Well, just remember all the divalent cations, for example, iron and others, they are absorbed from the duodenum except magnesium, which is absorbed from the ileum. Most of the magnesium, major chunk of it, gets absorbed from the ileum. So again, if the ileum has been removed, magnesium deficiency is a possibility in this patient. So obviously what's incorrect, and therefore the answer is the dumping syndrome. Well, dumping syndrome is generally known to occur after gastrectomy, removal of the stomach rather than removal of the ileum. What happens is we consume hypertonic fluids or glucose, and stomach is going to cause those fluids to be normotonic before those fluids reach the duodenum, small intestine. Now if the stomach is removed, then hypertonic fluids will straightaway reach the small intestine, the duodenum, and then it results in what is called as dumping syndrome. It has got two types actually. Hypertonic fluids will pull a lot of water from the blood vessels. This water from the blood vessels has come into the duodenum because duodenum has now hypertonic fluids, and therefore suddenly the blood volume will decrease after consumption of such fluids, and blood volume, blood pressure decreases, the person will feel dizziness, giddiness, or a lot of glucose straight away reaching the duodenum and getting absorbed very fast. It will cause insulin to be secreted, and that insulin will push the glucose into the cells very rapidly, resulting in hypoglycemia. So again, fainting or dizziness, giddiness, etc. These are the manifestations of the dumping syndrome, as if the glucose is dumped or hypertonic fluids are straight away dumped into the duodenum. So that happens in the case of removal of stomach and not removal of ileum, which was the case mentioned here, and therefore that was the answer.